Okay, also included in Unit 11 is the respiratory system, which is Chapter 20 in your textbook. The respiratory system consists of your lungs, your bronchus, your trachea, your larynx, your pharynx, and your, yeah, that's everything. So pharynx is your throat. The lay term is throat. Larynx, the lay term, is your voice box, and trachea is your windpipe. And then you see where the bronchus breaks into bronchioles, which are little smaller segments. Functions of the respiratory system is to filter the air we breathe, bring oxygen into the lungs, remove carbon dioxide from the lungs, produce sounds associated with speech. Respiration includes an inspiration and an expiration, or an inhale and an exhale. Changes in the respiratory system due to aging: the lung strength decreases, the alveoli become less elastic and decrease in number, airways become stiff, lung capacity decreases, and the rib cage changes. Chest muscles weaken. Cough reflex becomes less effective. Your cough weakens. Oxygen in blood decreases, and the voice weakens. Disorders of the respiratory system: chronic obstructive pulmonary disease, or COPD. It means that they have chronic bronchitis, which means it doesn't go away, and emphysema. Those two things is what makes up COPD. Pneumonia is inflammation in the lungs. It can be caused by a virus, bacteria, or irritants. Elderly are at higher risk because of all the changes in the respiratory system that I listed previously. Asthma, irritants, allergens cause inflammation in the air passages, may also be induced by stress and exercise, can be triggered by strong smells, smoking. Mucus is produced, which further constricts the bronchi. Air trapping in lungs causes the wheezing you hear with the asthma. Tuberculosis, or TB, is a highly contagious airborne disease caused by the Mycobacterium tuberculosis. Pulmonary disease causes prolonged coughing up blood, which the medical term for that is hemoptysis, shortness of breath, night sweats, weight loss, and fatigue. If TB is left untreated, it can lead to death. And that is why you guys all have to get your TB test. Sputum collection. For sputum collection, mucus is coughed up from the lungs or the bronchial tubes. It is cultured for evidence of infection or to diagnose lung disease such as TB. It is best to be collected in the morning or AM when the resident awakens and before eating. The resident should rinse their mouth out with water before collections, but not with mouthwash. Have the resident take 3 deep breaths and cough. The specimen needs to come up from the lungs. And then they would expectorate or spit. Basically, it's not spit, but it's expectorate means to cough up the sputum into a sputum collection container. Oxygen is considered a drug. It must be ordered by a physician. CNAs cannot stop or start oxygen, and they cannot adjust the flow rate. Any problems with delivery device or resident needs to be reported to the nurse immediately. Nasal cannula. That first picture is a nasal cannula. It has a set of prongs that go into each nostril and is most comfortable to use. The simple face mask fits over the mouth and nose. It is a higher concentration of oxygen and is not as comfortable, and it also interferes with eating and talking. Oxygen delivery systems. This is a oxygen concentrator. It filters oxygen from normal air. It delivers low flow oxygen, usually per nasal cannula. Humidity bottle is attached, and humidity bottle and tubing changed weekly in PRN. So this is what you'll see. It looks similar to this. They're smaller, I think, in the nursing home, but they'll have this at the bedside, And often when they leave to go like to the dining hall, they'll switch to like an oxygen tank in a bag, because this is cumbersome, obviously, to take down to the dining hall with them. Incentive spirometry is used to expand lungs after surgery, illness, or injury. It encourages the patient to cough and deep breathe, which helps prevent pneumonia and atelectasis, which is lung collapse. There's a video on how to do incentive spirometry that is also included in your videos for the unit under content for Unit 11. And that is it on the respiratory system.